Welcome back to Focus on South Texas. Since 1957, the San Antonio Council on Alcohol and Drug Awareness has served the community with prevention and intervention services. Not only does SACADA facilitate court-ordered classes, but they offer many resources for children and adults about substance abuse. CEO Abigail Moore is here to tell us more about what SACADA has to offer. Welcome to the show. Thank you so much for joining us.
Thank you for having us.
Well, Abigail, outside of a pandemic, life can be stressful. And of course, it's important to maintain good behavioral health. Well, how has mental health been impacted by the pandemic and just everyday life?
It really has been impacted. So we're at about 58% of adults reporting struggling with mental health related issues, and 75% of young people and children reporting that they're struggling with mental health wellness.
And Abigail, from what you've seen, how does stress or job loss connect to drug or alcohol abuse? I'm sure you see kind of this goes hand in hand sometimes.
Yes, they do. So they just really intertwine and increase each other. So when people are struggling with mental health issues, they often struggle with substance use disorders. And then when you add the loss of employment or having to stay isolated from school and their peers, it really exacerbates that, and it increases the volatility of people struggling with substance use disorders and mental health issues.
And what resources do you offer for adults that might need help? I'm sure some adults, they are struggling, but they may be afraid to get that help. They may not want to get that help, but there is help out there. And I think that's the important thing to take away, to let people know that there is help if you are struggling. So what kind of help does SACADA offer?
First, we want to remove the stigma. Substance use disorders is a disease. We want people to get help. And we provide free resources by a recovery coach, a person in long-term recovery, to get them connected to recovery, to the resources that they'll need, and to help them understand the disease a little bit more, them and their families. So we offer free recovery support services. We also provide free mental health awareness first aid training in our community. So it helps people understand what is mental health related issues, what do they look like, and what are the resources out there. And so we're able to help people understand through mental health first aid, the issues and the impact that mental health can have on them, and the resources available to help them.
Right, and I think that's also important to touch on, because I think that sometimes people may be struggling, but they may not be sure what they're struggling with. They may start feeling a certain way or acting out a certain way, and they just don't know what to do. So I think SACADA can also guide them in the right direction when it comes to that, right?
Yes, we do. We provide, again, the resources are free, they're confidential, and we just help them navigate through the process, whether they need treatment or just a recovery support group or just education, information. We help them and we guide them. And again, it's all free and it's confidential.
And not only are there resources for adults, but there are resources for children and teens, because this can affect everybody. At what age, though, should parents and guardians start talking to children and teens about drinking and drugs? I know these are tough conversations, and sometimes maybe parents don't want to have them. But how can you help them with that?
Melissa, we have to start young. The average age of first use in Bexar County is 11 and a half years old. So we have to get to them younger. We believe that prevention can be started as early as first grade, and it's done developmentally appropriate. So we provide evidence-based education to children. We help parents learn how to communicate and to talk to their children about these things. And then we're also in about 13 to 14 school districts around not only the city, but the other communities as well.
Through this pandemic, Abigail, have you guys seen, an increase of calls or an increase for information for people, wanting to get help or advice?
Absolutely. So the United States had 200,000 overdose deaths in 2020. The numbers in Bexar County have also increased. The requests for services have more than doubled. So we know that the need is great, and we just want people to know that we're here for them. All they need to do is reach out to us either via email, on our website, call us. They can have these services virtual. They don't even have to come into the office if they don't want to.
And the services, and I think what's great about this as well is that they are catered to the individual, regardless of what you are struggling with or what help you may need. I mean, this isn't like, okay, here's the guideline and we're going to do this, this, and this. You actually cater to the person and kind of what their needs are.
Absolutely. We create a recovery plan with them. And so we really listen to them and identify what are their strengths, what are their challenges, what does their support group environment look like? And then how can we support them finding the resources that they need? So every individual is different. Same thing with children and young people. When we do evidence-based curriculum and life skills training to children, we really try to engage the kids where they're at school. So we do most of those work in the schools. We also have summer camps, spring break camps, and even holiday camps, and teaching the kids how to cope with the challenges that they're having now.
And what advice, Abigail, do you have for viewers right now? Because, the old saying goes, every person has a story, and that is so true. What advice do you have for our viewers?
Self-care is so important. We really want our audience and our community to feel comfortable reaching out for help, getting information, getting the knowledge, and then getting the skills and the tools that they need just to live healthy and productive lives. So it is about getting the information out. It's about finding recovery. It's about getting educated, and prevention is key. So if we can prevent mental health related issues or substance abuse related disorders, we can prevent them. And that's by equipping individuals with the life skills that they need, the coping skills that they need, and the knowledge.
Abigail, thank you so much for sharing and for providing such important information. And I really do hope that viewers who are seeing this, who may need help, may be struggling, may know somebody that's struggling or need advice for their children, to contact SACADA.
Yes, thank you.